Have you ever wondered what a pharmacy technician is? I have no idea. I'm in marketing. So let's go find one and ask. Hello.
Hi, how are you?
Good, how are you doing?
Good. What can I do for you today?
You can tell me what it means to be a pharm tech.
You are the face of the pharmacy. You are the first person that you either come into the pharmacy and see in person or on the phone. We are the first person who sees your prescription as it comes in electronically from a doctor's office, hospital, wherever it's being sent from. We're very important to the pharmacists because we are their first person that helps them out with getting information. We can call the office for them. We can call insurance for them. We are the most important person to the pharmacist.
What does a typical day look like for a pharm tech?
We come in, we get our computers going, we start going through our refill queue or our new queue, pulling medications and filling those prescriptions, give them over to the pharmacist who are checking to make sure everything is correct, put them in a bag, and we would just wait for the patient to come pick them up, call doctor's offices, take people as they come in, or call us and ring them out each day. If you want to follow me this way, I'll show you a little bit of what I do.
Great.
This is a lot of our medications. Pick which one you want. You take it and then you're going to go back over here to your station. This is our counting tray here. We will take our medication, dump it on here. You have a label that says what we need to have. We just make sure that the NDCs match, count out what we need. Then we grab a bottle from our mini bottles here. We just choose the appropriate size that you will need. You will then dump your medication into the bottle, stick your sticker on there, then put it in one of these baskets and hand it over to your pharmacist for them to do their checking.
What's the difference between a pharm tech and a pharmacist?
The pharmacist is more the person who makes sure everything is right on the prescription after we have filled it and chosen the right patient. Interactions with medications or allergies is correct, dosing is correct. Our responsibilities are to answer the phones, put in prescriptions when they come in, choose the right medication, count it out, then hand it over to the pharmacist for them to make sure we did our job right. The pharmacy technician is on the job training. It's a year and then you get certified through the NHA or PTCB. A pharmacist, they go to school for, I would say, 6 years. It's common to start out as a technician and then go on to become a pharmacist.
Nice. So there's career growth opportunity within this role.
Yes, there is. Very much so.
Do you have to work in a hospital or can you work in other environments?
There are several options for them. They can work in the retail part, the inpatient, specialty, and long-term care. Each one of them has their own different challenges. They're not all the same.
Can you describe the differences between them?
Retail pharmacy is basically most of your prescriptions that come from a doctor's office or from when somebody's discharged from a hospital or surgery. Inpatient pharmacy is anything that is in the hospital. They deal with a lot of IV fluids, stuff like that. Long-term care takes care of nursing home patients. The specialty pharmacy is for specific disease states. Anybody that is a cancer patient or has pulmonology issues, so stuff like that.
A question I'm sure everyone is wondering, what is the pay scale for a pharm tech?
Between $17 and $30 an hour, just depending on your seniority and where you're at. You need to be able to multitask, know some medical terminology, that's a big plus. Be very open with learning new things because everything is always changing. There's always a new drug, a new generic, so you gotta kind of stay on top of that. It's very much worth it because you learn so much and there's so much room to advance onto more. It is one of the most rewarding things to help patients and their family members. It's very rewarding. It is just a year, and then after that, if they decide from then on they want to do something, they can do that, but this is a great way to start getting into healthcare.
Brandy, thank you very much for your time today. Thank you all for watching, and we wish you the best of luck in your healthcare careers. Bye.
Bye.